Okay, so today we're going to be talking about the management of hazardous materials. This is on chapter 12 and it starts on page 247 of your textbook. So what we'll be doing in this chapter is identifying the scope of OSHA bloodborne pathogen standard and the hazardous communication standards. We'll explain the purpose of the hazard communication standard, abbreviated the HCS. We'll identify three major changes of the HCS to align with the globally harmonized system of classification and labeling chemicals, or the GHS. We'll demonstrate some safe disposal of sharps. We'll describe the purpose of the safety datasheet manuals, and describe the employees' training that is required to meet the OSHA standard for hazardous chemicals. So OSHA's objective is to provide safe work environment for all employees. OSHA is known as the Occupational Safety and Health Administration that dictates the standards that all medical offices must follow to establish a safe environment for staff and patients. The bloodborne hazardous material standards scope and application includes all employees at risk of exposure to blood and other potentially infectious materials. So this is otherwise known as OPIM, or other potentially infectious materials. The standard applies to all employees who may come into contact with blood and OPIM. This includes part-time employees, designated first responders, mental health workers, and exposed medical personnel. OPIM includes saliva, cerebrospinal fluid, unfixed tissue, semen, vaginal secretions, and body fluids visibly contaminated with blood. The method of compliance includes standard precautions, which basically means that everybody should be treated as though they are infectious with some type of disease. Engineering and work practice controls should be in place. PPE consists of personal protective equipment and housekeeping, which includes laundry and other proper disposal techniques. These are all covered under the OSHA guidelines. So all blood and OPIMs are considered infectious, and the same standard precautions should be taken whenever at risk for exposure. The use of standard precautions should become a routine part of one's workday. Engineering controls should be the primary method of controlling exposure. These must be evaluated and documented regularly. So engineering controls consist of the use of needleless IVs, self-sheathing needles, sharps disposal containers, covered centrifuge buckets, aerosol-free tubes, and leak-proof containers. This is the first line of defense against exposure. Continued evaluation of these controls must be done to ensure they are working to prevent exposures, and if not, they should be revised and adjusted to ensure the safety of the workers. Sharps containers should be accessible in all work areas where needles or sharps are routinely used. They need to be made of a durable material that will prevent the contents from contaminating or injuring workers. They should be clearly labeled as to the contents of the containers and should be routinely replaced so as to not overflow. Some work practice controls and rules consist of hand washing. Hands must be washed before glove removal. Needles must never be recapped by using two hands. They should never be broken or bent. Eating, drinking, and smoking is prohibited in all work areas. Storage of food or beverages is not permitted in areas where blood or OPIMs are stored. You also want to minimize splashing and splattering of all blood and OPIMs whenever handling and during disposal. Do not practice mouth pipetting. So this means instead of using like a needle dropper to draw out fluids out of a vial, I guess it was used to be common practice for people to use their mouth to suck out the contents out of a vial. I don't know why we need to tell you that, but please don't do that. You want to transport the specimens in leak-proof labeled containers, decontaminate the equipment and work areas, and also you want to label any areas that cannot be decontaminated. These are things like what we call fomite, or soft things like gauze, cotton rolls, things that can't be decontaminated. Those should be labeled and stored in leak-proof containers that can be sprayed and wiped down and contaminated. PPE is short for personal protective equipment. These can include goggles or face shields, gloves, protective overgarments like lab coats and lab jackets, resuscitation equipment, and these all should be readily accessible and stored at the worksite. So it's the employer's responsibility to provide personal protective equipment at the worksite. The equipment must be readily accessible and be in adequate supplies. All employees must be required to use personal protective equipment. Eye protection should be worn by employees at any time there is a risk that blood or opium could splash, spray, or splatter and access the eyes or mucous membranes. If an employee wears prescription glasses, these can be fitted with side shields. A mask or face shield is also recommended to be worn with eye protection. And this is actually the preferred eye protection available. Not only does it protect your entire face from splash or splatter or flying objects, but it is, in my experience, the most comfortable. I can have a face shield on all day and not even realize it. They're really good at not fogging. They don't get in your way. They don't fall down, things like that. So I recommend a face shield if and at all possible. There should be a decontamination plan for dealing with any exposure. Gloves are required when handling any blood or opiums. Gloves may be made of vinyl, latex, powderless, latex-free, or utility for handling surface disinfection, or puncture resistant for handling sharps. Protective clothing must be worn when there is a risk of splash, spray, or splatter of blood and opium. The choice of clothing depends on the procedure and risk. The various types of clothing available consist of low-level exposure lab coats, moderate exposure fluid-resistant gowns, and high exposure fluid proof aprons with foot and head protection. Employers must provide laundry service for all clothing that is to be contaminated. There should be a regularly adhered to written schedule for cleaning and disinfecting. As soon as feasible, equipment and work areas that have been contaminated should be cleaned and disinfected. Any material contaminated with hazardous materials must be disposed of in clearly marked and leak-proof containers. These containers must have the ability to close and should be placed in a secondary container if the outside of the container is contaminated. With laundry, we want to use as little handling as possible, especially with dirty laundry. And it's the employer's responsibility to provide laundry service. Soiled garments should be placed in clearly labeled and color-coded bags, and the bags should be leak-proof. All employers or all employees are at risk for exposure to blood or opium are given the opportunity to be vaccinated against HBV within 10 days of employment. This is the hepatitis B vaccination. Employees may refuse the vaccine, but must sign a declination form. If the employee wants to get a vaccine at a later time, it will be made available. Vaccination is free and is given under the guidelines of the U.S. Public Health Service. Despite all best efforts, exposure incidents will occur. When an exposure occurs, the employee should immediately wash with antimicrobial soap and get blood drawn for testing immediately. The incident should be documented and include the identity of the source if known. So the source would be the patient where the blood came from. The source or patient should be asked to agree to testing. Once the results are back, they should be shared with the employee who was exposed. Labels should be placed on all containers with blood or open in them. The containers themselves must be color-coded. These labels are required on regulated waste receptacles, refrigerators, freezers, transport or storage containers, and contaminated equipment containing blood or open. Upon employment, all employees at risk of exposure to blood and opium are required to undergo bloodborne pathogens and hazardous materials training. This training is repeated annually or at any time a standard has been revised or updated. The training should be presented at a reading and comprehension level appropriate to the employees. The training should be interactive and allow the employees to ask questions. Training consists of an explanation of the bloodborne pathogens and hazard material standards. The symptoms of bloodborne diseases are explained, as well as the modes of transmission for most of the common viruses like HIV and HBV. An updated exposure control plan should be in place, and engineering controls should be the first line of defense. The exposure control plan is explained, including the proper use of engineering controls and PPE. Explanation for proper documentation are also discussed, explanations for proper decontamination are also discussed. Information is provided on the HBV vaccination, post-exposure follow-up procedures, and the requirements for labeling and color coding of hazardous waste materials. The employer keeps medical records for each employee. These records are kept and maintained for 30 years plus the period of employment. They include documentation of vaccinations, exposure protocols, and opinions written by physicians performing the physical examinations. Employers are required to keep records of the training their employees attend. These records are maintained for a period of 3 years. The training level of the trainer, the contents of the training, and the names of the persons attending the training are all to be recorded. Any workplace with the potential for occupational exposure to bloodborne pathogens is required to have a written exposure control plan. This plan must comply with the OSHA bloodborne pathogen standard and must document existing workplace references for policies and guidelines for handling exposures. The exposure control plan must be written and should contain the following: a list of all job classifications for which employees are at risk for exposure to bloodborne pathogens, a list of all job-related tasks that put employees at risk for exposure to bloodborne pathogens, a written plan stating how the facility is compliant with OSHA bloodborne pathogen standards, the procedures the facility follows for disposal of sharps, the procedure the facility follows for disinfection of rooms, equipment, etc., the procedure for the proper use of personal protective equipment, and the procedure for the disposal of regulated wastes. The occupational exposure determination lists the task of each employee and identifies the risk categories those duties fall into. For example, category 1 would be employees that are routinely exposed to blood, saliva, and body tissues. This is usually the dentist, the hygienist, the assistant, or the laboratory technician. Category 2 would be people that are occasionally exposed, but not regularly exposed. These can be coordinating assistants or receptionists that may routinely go into the operatory for a period of time to discuss treatment options and benefits coordination. Category 3 are employees that have no exposure or no risk of exposure to any opiums. These are accountants, insurance processors, or regional managers that may visit your office. An exposure control plan should include a procedure for laundering uniforms, linens, etc., policies regarding vaccination of hepatitis B, procedures to follow after exposure, training of employers related to bloodborne pathogens, training of employees related to bloodborne pathogens, and the exposure control plan must be accessible to all employees and must be updated annually. Employee responsibilities include attending training, following the rules, and practicing universal precautions, safe work practices, and engineering protocols. Also, they must use PPE whenever possible. The employee must cooperate with the employer to maintain and be compliant with OSHA bloodborne pathogen standards. This is not optional. The employer may be fined up to $10,000 per employee if regulations and standards are not being met. All right, so here's a dental check. I want you to think about all of the opens that I listed or that we talked about, and I want you to think about them in your head. See how many you can come up with. Well, here's a list of them. So that's blood, saliva, cerebrospinal fluid, amniotic fluid, synovial fluid, pleural, peritoneal and pericardial fluids, semen and vaginal secretions, and any unfixed tissues. These can be tissues that slough off during a procedure, pieces of tooth, pieces of gum tissue that we as dental assistants routinely come into contact with. So even after the first publication of the OSHA bloodborne pathogen standard, needle sticks and sharps injuries continued. This prompted inquiry and action by the US Congress, and the result was the Needle Stick Safety and Prevention Act of 2001, which required OSHA to revise the standard. The revisions to the standard were effective in April of 2001. The revisions to the standard required that employers must solicit input from employees regarding the exposure control plan. This input must be documented in the exposure control plan, and the employees providing input must be non-managerial and must perform a variety of direct patient care interactions. The employer must also keep a sharps injury log to document all sharps related injuries, including device locations and description of the incident. The revision of the standard also requires employees to use safer medical devices, such as needleless systems or sharps with safety devices whenever feasible. Some of the engineering and work practice controls include splash guards, sharps containers, ventilation hoods, and needleless systems. These devices are determined to reduce or minimize the risk of occupational exposure. It is the employer's responsibility to provide and maintain these devices, and it is employees' responsibility to learn and properly use the devices. So sharps related injuries are the most common type of incident causing exposure and risk of contamination related to bloodborne pathogens. The employer must provide devices that offer safer and effective means of preventing such injuries, such as needleless systems or needle guards. The employee must be properly trained to use the equipment and must be aware of the proper means by which to dispose of the equipment. So with sharps, you want to use these needle recapping devices if at all possible, and you never want to recap using two hands. The reason being is when you put these two instruments together, the needle and the cap, it is very easy to accidentally miss the cap and have the needle puncture your finger on the other hand. So these needle guards were designed to prevent that from happening. But if you can imagine, these needle guards are made of some very thin cardboard. And if you're careless enough, you can still puncture yourself using a two-handed recapping technique. So instead, you would want to use a one-handed, we call it a one-handed scoop technique, where you would place the needle cap on the counter, and with one hand, you would scoop up the cap with the needle and then recap it that way. Sharps containers should be red. They should have a biohazard label on them. They should be puncture resistant, leak proof, and they should have a sealed lid. When Sharps containers are full, they are sealed, sterilized, and sent to an outside biohazard agency for safe disposal. When an employee is victim to an occupational exposure to bloodborne pathogens, it is the employee's responsibility to report the incident immediately. The employer must provide the employee access to a medical evaluation and provide testing to the employee. The employee can decline testing for up to 90 days. A complete incident report must be written that includes the route of exposure, the circumstances surrounding the incident, and the identity of the source of the incident. The employer must provide follow-up procedures to the employee that include counseling, prophylaxis, and evaluation of related illnesses. The employee right to know law states that employees have the right and need to know the identity and health hazards of chemicals they use in the dental office. Information and training must be provided to each employee to ensure that standards are upheld. A record of all chemicals in the office is necessary, as well as written instructions for handling the chemicals. According to OSHA guidelines, MSDS sheets should be on site, and all chemical containers must be labeled with their contents. So the SDS, which is an abbreviation for safety data sheets, otherwise known as MSDS or material safety data sheets, identify chemicals in each product, as well as any health and safety information pertinent to the product. These informational sheets are supplied by the manufacturer and should be stored in a labeled notebook that is easily accessible to everyone in the office. Chemical warning labels were developed by the National Fire Protection Agency. These labels warn employees about using chemicals, or they warn employees using chemicals about the hazard that each chemical has. So if you look on figure 12-12 on page 267, there is a handy little chart that it's kind of a key to what these mean. So these hazard labels are color coded, or they're diamond shaped as well. There is a white label, a blue label, a red label, and a yellow label. If you noticed in the picture here, each label has some type of number denoted in each of the squares. Okay, each of these numbers means something. And in that table on figure 12-11, excuse me, I said 12-12, I meant 12-11. These will tell you what they mean. So for example, the red or fire hazard label has different numbers. If there's a 4, it means there's a danger. There's flammable gas or extremely flammable liquids. A 3 would be a warning, or there might be a flammable liquid. A 2 would be a caution, where there is a combustible liquid. And a 1 would be a caution, where the item is combustible if heated. So there is a difference between combustible and flammable. Combustible just means that it will ignite into a flame. Flammable actually means that it's explosive. Okay, so flammable is definitely more dangerous than combustible. The yellow has to deal with reactivity. A 4 would indicate that the substance is explosive at room temperature. A 3 would indicate it may be explosive if a spark occurs or if heated under confinement. A 2 would just be a warning that it's unstable and may react if mixed with water. A 1 is just a caution. It may react if heated or mixed with water. And 0 would be stable. It's non-reactive when mixed with water. A blue would mean that there is some type of health hazard, where a 0 would mean there is no unusual hazard. A 1 would be a caution that it may cause some irritation. A 2 would be a warning that it is harmful if it's inhaled. A 3 would be a warning that it is corrosive or toxic. And a 4 is danger, that it may be fatal. A white has to deal with what PPE should be used to handle this substance. And instead of numbers, these are denoted with letters. So if the item has an A in white, that means goggles should be worn. If there is a B, that means goggles and gloves should be worn. A C means goggles, gloves, and aprons should be worn to handle the substance. A D would mean face shields, gloves, and aprons should be worn. An E would indicate that goggles, gloves, and a mask should be worn. And an F would indicate that goggles, gloves, an apron, and mask should be worn. And then an X just means that only gloves need to be worn when handling the substance. Here is our last dental check. What color on a warning label indicates the substance poses a health hazard? Well, if you guess blue, you are correct. All right, so this is everything I have for chapter 12. Please let me know if you have any questions. Thanks for listening.